So we started with this stuff already briefly, right? But I'm just going to pretend that we didn't because you slept since then and had a test and you don't remember anyway. So let's just go back to the basics of muscle mechanics. My objective here, guys, is to take us as a group from rote memorization of muscles to learning with understanding of muscles, so that you start to see patterns and start to figure out what you can figure out about muscles by instead of doing rote memorization. Did I start that recording? Oh yeah, I did. So when I learned muscles the first time when I took comparative vertebrate anatomy, I memorized them, which is what most people do. And then guess what happened when I had to take advanced anatomy? I didn't know any of them. So what I would like for you guys to do is to have enough understanding that you have retention, because I would like for you to retain this into your clinical classes, and I would also like for you to retain it to the point that you are taking care of me, right? So if you are my PT and I've messed with my psoas major and you're like, I totally know where that is, then I will feel better about the work that you're doing. So we're going to approach muscles from a logic point of view. We're going to go back to what we talked about before. So when we were talking about skeletal muscles, there is a mechanics, a pattern to the mechanics that you can look at with skeletal muscles. Skeletal muscles are, of course, going to have at least 2 points of attachment, like we talked about before. Generally, one of those points of attachment is relatively immovable, right? Sometimes they say completely immovable, but you know there's going to be an exception to that if something. And then there is another point that moves upon contraction. And those 2 points are usually referred to as the origin and the insertion of the muscle. Sometimes they'll call them, some textbooks, by the way, prefer superior attachment and inferior attachment, or proximal or distal attachment. I like origin and insertion because it tells you functionality pretty quickly. So I'm generally going to use those. So muscles are simply, all they really do is pull. And when a muscle pulls, what it's going to do is it's going to pull the movable point closer to the immovable point, right? Because that's what it has to do, right? It's only one of the points that's potentially movable. And that movement will correspond to the muscle's action. Does that make sense? So muscles only pull, they never push. So I don't know if we talked about this last time, but let's go ahead and start practicing a little bit. So if you look at the mechanics of how a muscle works, right? And you know that muscles only pull, they never push, yeah? And then I'm going to tell you one more piece of information that's really, really pertinent, and I want you to stick it in your head over and over again. You can't move a joint without crossing a joint, okay? So you cannot move a joint without crossing a joint. So I want to show you this action, and I know this isn't very hard for you, so we're going to start with an easy one, right? So this is the action that we're going to do, right? And I want to tell you this action that we're doing right here. If muscles only pull, they never push, you can figure out which side of the joint the muscle is on that is responsible for doing this. Yes? Can you not? Where's that muscle? It's on the anterior surface, okay? And since muscles only pull, they never push, you cannot do the opposite action with the same muscle. Does that make sense to you? Okay? So obviously, where does the muscle have to be that does the opposite action, which is this? Posterior side. Okay, so what you will see is in order for muscles to do opposing actions, you generally need to put them on the opposite sides of the joint. Yeah? Those are called antagonistic pairs. Yeah? So the muscle that does whatever action you talked about first, yes, would be the agonist. You with me? So name me a muscle that might be the agonist for this action. Biceps brachii. Okay? The muscle that does the opposite of the thing that you talked about first would be the antagonist, triceps brachii. And sometimes the agonist has a helper. Sometimes there's more than one muscle that acts at a joint. Do you know one that's deeper than the biceps brachii that helps with this action? Radialis, exactly. Okay, that's called a synergist. So if a muscle has a helper, it's going to be a synergist. Now, do all muscles have helpers? No. But let me show you one that you haven't really gotten into very deeply yet, unless, of course, you just had lab. You might have done it. Okay, ready? Okay, I want to I want you to think about the mechanics again, and I'm going to show you in action, and I want you to touch on your body where you think the origin is and then the insertion. Okay, ready? So here's the action. Closing the jaw. Where's the origin? Play around with that origin, not the mouth, closing the jaw. Where's the origin? Yes, origin here, insertion onto the mandible. What does it do? Pulls the insertion closer to the origin. With me? So that's called elevation of the mandible. Now what I want to practice with that is, even though you don't learn the muscle that does the opposite, I want to see if you can figure out where it would be hooked up. So the muscle that does the opposite, so this is elevation of the mandible. This is depression of the mandible. Where is the muscle going to be that does depression of the mandible? Origin where? Origin has to be down here somewhere, yes? And the insertion where? The mandible, yes? Do you see? Okay, does that make sense? Okay, so this would be the agonist for the action that I talked about, the masseter muscle right here. Origin, insertion. The antagonist, down here to up here, yeah? And then the masseter actually has a helper called the synergist, and it's the temporalis muscle. And the temporalis muscle goes all the way from here down to here, and it helps with this. It's not very strong, so it doesn't get to be the agonist, but it increases the range of motion, so it helps as well. Can you see how if you had an origin up here and an insertion down here, you can help with this action? Yeah? Got it? Okay. So muscles are generally arranged in opposing pairs. You have an agonist and antagonist, and sometimes, but not always, you have a synergist. Okay? All right. So now, here's what we are going to start practicing with. You guys are going to use your bodies. You are going to get things wrong, and it doesn't matter because that's part of the learning process, right? You are going to try to figure things out. You're going to touch places. You're going to wiggle, and then you're going to learn. Okay. So we're going to start to move to body movements. So you guys remind me, body movements are, of course, going to happen at joints primarily. What is the most wiggly joints that you have? Synovial joints. So primarily what we're going to be talking about today is mostly, not exclusively, mostly actions that happen at synovial joints because they're the wiggliest parts. Good? Okay, so these actions, by the way, are still in chapter 9 because remember chapter 9 was articulations. So we talked about just the basics of articulations, and now we're going to talk about the actions at your joints, okay? And really, the actions are going to directly correlate to your body movements. Note to self, by the time you master muscles, you are going to be tested in lecture over all of your lab muscles as well, okay? But that's a while from now, right? You don't have that lecture test until I think after you even have your lab test. But I'm going to teach you some patterns, some ways to remember this stuff. So you are going to have chapter 9, just the rest of chapter 9 that we didn't do before, the stuff that's in your notes. And then chapter 10 is like muscle tissue and really how it contracts at like a submicroscopic level, which is really important for physiology. Chapter 11 and 12 are the ones that are axial and appendicular muscles, and that's the ones you're working on in lab. So you always use your notes as the guide for what to study for your lecture test. Good? All right. So what we are going to start with is we are going to do body movements allowed by synovial joints. So first thing is you have to get some vocabulary down. When you're at the gym and you say you flex your tricep, it means something entirely different than it does in anatomy. So flexion means something specific. Extension means something specific. Abduct and adduct means something specific. And we have to use the correct anatomical meanings of these words. Does that make sense to you? Okay, so I want to talk about what flexion means and then what you can determine about a muscle knowing that it's a flexor. So what flexion is, we'll do it a couple of different ways. Flexion starts from anatomical position and decreases the angle between bones, right? So did we do this in this class last time? Start at 180? Okay, so we can go through flexion relatively quickly. So we start at 180 and we decrease the angle between two bones. That's flexion, okay? Now, with that in mind, you guys tell me if you remember from last time or if you just generally understand, muscles responsible for flexion are generally going to be on what side of the joint? Anterior side of the joint, with one exception, the knee. Yeah, okay? Now, I want you guys to show me some flexion. You ready? Show me flexion at the neck. That's flexion at the neck. Yes? Now, this one's a little hard for people. Show me flexion at the shoulder. This is flexion at the shoulder. Just imagine that the plane keeps going, right? Does that make sense? This plane of the shoulder keeps going, okay? Show me flexion at the hip if you can. Flexion at the hip is here, yes? Okay, got it? Show me flexion of the vertebral column. This is flexion of the vertebral column, yeah? Bending over. So this is flexion of the vertebral column here. And we practiced with this one a little bit last time. Flexion of the vertebral column. It's going anterior, right? Okay, so wrist flexors are going to be located where? Where are they? Anterior surface, right? They have to cross the anterior surface of the wrist. You guys with me? Elbow flexors are going to do where? Anterior surface of the elbow. Shoulder flexor has to cross the anterior surface here. Yes? Okay. A hip flexor would cross where? Anterior surface here. How about a knee flexor? Yeah, the knee flexor is going to be on the backside. That's the exception to the rule. Does that make sense? Okay. All right. So flexion, muscles responsible for flexion is generally going to be on the anterior surface of the joint with the exception of the knee. Okay. Extension and hyperextension. Let's talk about those and let's do a little bit of it. Extension is increasing the joint angle. Watch, we'll start from here. But generally, extension is just putting it back to anatomical position, right? Increasing the joint angle, usually starting from a flexed position, okay? Extension, okay? So where is a muscle responsible for extension generally going to be? Posterior surface, okay? So I want you guys to show me, hold up your hands, show me wrist flexion. Wrist flexion. Show me wrist extension. Yes. Wrist flexion, wrist extension. Now go in anatomical position and do it. Wrist flexion. Do you see that the muscle is responsible for doing that and you can feel them? On the anterior surface, show me wrist extension. Feel the muscles. Back there. Does that make sense to you guys? Okay. So, extension is defined as increasing a joint angle. It tends to be a straightening action. So let's just do a little bit more. Are you ready? Tell me what action I am doing when I'm doing it. Ready? Flexion of the vertebral column. Extension of the vertebral column. Some joints can go past anatomical position. If they can, it's hyperextension. Yes? Okay. So show me flexion at the neck, extension at the neck, hyperextension at the neck. Yeah? Let's do it at the shoulder. Ready? Flexion at the shoulder. Extension at the shoulder. I'm going to let you guys lead me. Hyperextension. Hyperextension back. Yes? See it? Okay. Flexion at the knee. Can you do it? Sitting down. Extension at the knee. Can you hyperextend your knee? Not more than once. Okay. How about the hip? You can't do it sitting there. Flexion at the hip. Extension. Hyperextension. Okay. Now I'm going to ask you a logic question. The gluteus muscles, even if you haven't memorized yet, those are very likely to do which action? Flexion or extension? Extension. Extension. Yes, they have to be on the posterior side. Does that make sense to you? Yeah? Okay. Do you see? This is extension. Back side is going to be extension, right? The gluteus muscles. They are not flexors. Does that make sense? Got it? Okay, let's try these muscles that everybody freaking hates because they're confusing as hell. You're running through these leg muscles, and you run into some of the quadriceps muscles. And the quadriceps muscles, some of them go past the hip and past the knee. Yeah? Not all of them, but some of them do. Okay? And then people are reading, and they're trying to understand the muscle action, and they get confused as all hell because they are reading these muscles, and it says that some of the quadricep muscles do what at the hip? Flex at the hip, and what do they do at the knee? Extend at the knee. And you're like, what the hell? You just told me flexion, and then you told me extension. Because where do they run? Anterior surface of the hip, which means they will flex, yes? And then anterior surface of the knee, which means they will extend, yes? Do you see? It's not memorization, it's logic. Do you see? Why, Kisty, you have a weird look on your face. Oh, okay. Oh. I thought it was it wasn't glazed. It was like skeptical. She's like, what the hell are you talking about? Okay, so muscles on the back, right here, guys. They could probably do what? If they run all the way back here to here, they could probably do what at the hip? Extend at the hip and do what at the knee? Flex at the knee. Do you see? Okay, so you don't memorize actions, you understand actions. Yes? You check and check and check, you wiggle your body, you figure out how the hell that works, and then you don't have to memorize it. Yeah? Okay, so that's flexion and extension. So generally you're going to find a muscle responsible for extension on the posterior surface of the joint, except the knee. Yes, except the knee. The knee is a weird little joint. So we've got our flexors. Okay. Flexion, extension, hyperextension, flexion, extension, hyperextension. There's also lateral flexion. Lateral flexion just means that we've got some muscles over here that can actually do this. They just call it lateral flexion either way. Okay. Okay, so let's start with abduction and adduction. It's hard to hear the difference between those two terms. The names and the spelling definitely will matter because it only varies by one letter. What abduction means is that imagine a midline and take something away from the midline. To abduct, like to kidnap or take away, right? Does that make sense? Start from anatomical position. Start from anatomical position and take it away from the midline. And you can't do that at all joints, but you can do it at some of them. Okay, so abduction. It's not going to stay either. Okay. Okay, ready? Abduction. Yes, abduct to take away. Add it back. Abduction, add it back. Can you abduct at your elbow? No, you cannot. They don't move that way. Can you abduct at your knee? No. Can you abduct at your hip? Yeah. So this is abduction, adduction. Yeah. You can also, although this is counterintuitive, imagine this is the midline instead of my body midline, and tell me what I'm doing right here. Abduction of the fingers. Yeah. What am I doing here? Adduction. Yeah? Okay. So now let's figure out where the muscles are that are responsible for abduction and adduction. You ready? It's logic, right? You can get it. Go ahead.
I just have a question. Why can't you take your elbows and abduct them?
You start with anatomical position, right?
Like rotate them out?
That's a rotation. We'll talk about rotation. That's actually called rotation.
Okay.
Yeah, we will talk about that in just a second. So let's practice with one that's easy. You know this muscle, yes? The deltoid. The deltoid is responsible for what? Abduction or adduction? Abduction. So with that in mind, a muscle responsible for abduction is generally going to be on the what surface of the joint? Lateral surface of the joint, yeah? Does that make sense? So the TFL over here, if it was going to help with one of those two functions, which would it be? Abduction, yeah. And they don't all do exactly what you think they're going to do, but I just want you to have the logic pattern down, okay? Ready? Okay, so, and a muscle that was responsible for adduction is generally going to be on the what surface of the joint? It has to be on the medial, right? So you can pull it back in. Now note to self, you don't actually have any muscles down here, but they don't have to be right there. They just have to go medial, right? So does it make sense to you that, so deltoid does this primarily, right? And then this is adduction. The muscles that help with adduction can be the pectoralis major, and then one that goes on the back and does the same thing from here to here. Do you know that one? Latissimus dorsi, yeah? Do you see? So it doesn't have to be right here, but it has to pull that direction from the medial surface. Is that good? Okay, so where are the muscles that are responsible for doing adduction at the hip? Adduction. What are they called? They're called the adductors. Yeah, they're right here, the adductors. That makes sense? So the adductors are on the medial surface of the hip, right? And you know, do you see that when you're thinking about this now, you know where the origin and insertion are for the adductors? Is the origin down here? No, that doesn't make any sense. Where's the origin have to be? It has to be up here somewhere, yes? And the insertion has to be down here or else the physics won't work. Does that make sense? Got it? Are you starting to get it? I see like 3 light bulbs. The rest of them is like, I don't know, this thing isn't working. I don't know. Okay. Okay. So generally, you're going to find a muscle responsible for adduction on the medial surface of the joint. Good? Okay. So now tell me, I have this action we're about to talk about in a little bit of detail in just a second. What am I doing at my thumb? Abducting. Where am I going to look for the muscle that does that? Right along this side. What am I doing to my thumb now? Where am I going to look for the muscle that does that? Running along this. Does that make sense? Okay. All right. So now this one, circumduction, is just really, mostly you can only do it with ball and socket joints. It's not called the same thing when you do it with your neck, even though it looks the same. So circumduction is a complicated movement, but I really want to tell you that it's actually just 4 different movements in series. You ready? It's taking a limb and making a cone in space with it. Good. And you can do it here too, making a cone in space. But it's really just 4 motions in order. Tell me what the motions are. What's this? Flexion at the shoulder. Abduction at the shoulder. What's this? Extension at the shoulder and adduction at the shoulder. That's what circumduction is. Does it surprise you that any muscle that can do circumduction or any joint that can do circumduction has to have muscles on all 4 sides of the joint? Right? That should make sense, right? Got it? Okay, so that's circumduction. And then let's practice a couple that are a little less familiar to people. Okay, so this one will address her question. Lateral rotation and medial rotation. I want you guys to really think about these before I actually tell you the answers. Sort of practice with the mechanics for just a second. What lateral rotation is taking a bone and rotating it around its own axis, like twisting it in space, okay? So I want you guys to do it with me so you can feel it, because it looks like I'm moving my forearm, but I'm not, okay? My forearm is just following. So start in the anatomical position, you ready? And then rotate your humerus backwards, twist it. Do you see? That is lateral rotation because I'm rotating laterally, okay? Now go back to anatomical position. Take your humerus and rotate it medially, right? It looks like we're talking about pronation, supination, but you can tell that it's different when you actually do it with your body, okay? So I want you to think for just a second, and it's not immediately obvious. Where is a muscle going to be that's responsible for lateral rotation? Posterior surface, origin on where? The trunk somewhere, yeah? And insertion where? Onto the limb, right? Does that make sense? Now, if you insert it right back here, you don't get much range of motion, just a little bit, but if you insert it all the way past the midline, then you get a lot. That's the difference between, and this is even hard to see, you can do lateral and medial rotation with your hip, but it's really not very dramatic. So I start here and I just rotate my hip laterally, okay? And I can feel it happening back here. And then I rotate it medially. Why can't I get as much range of motion? Well, because the attachment point doesn't go very far onto the femur. It goes back here. Does that make sense? So that's lateral rotation. Good? Medial rotation. Do it again. Medial rotation. Where is the muscle going to be that's responsible for medial rotation? Where is its origin going to be? Anterior trunk, yes. And insertion? Onto the limb, yes. And if you've got it further back, you can move it more, right? Does that make sense? Okay, so that's lateral and medial rotation. And now we are going to practice a little bit with muscles that you have met, might not know yet. So we're going to talk about the pectoralis major, right? Pectoralis major, of course, has its origin on the anterior trunk and its insertion out here onto the limb. The minor, by the way, doesn't cross that joint, so you won't be at all surprised that the pectoralis minor doesn't have any humerus activity because it actually inserts onto the scapula. You with me? Okay. Okay. So, but the pectoralis major goes out onto the humerus. I want you to tell me if the pectoralis major is, even if you haven't memorized it yet, more likely to do abduction or adduction. Think about it. At the shoulder. Pectoralis major, abduction or adduction? Adduction, adduction, okay? And one more question. Pectoralis major more likely to do lateral or medial rotation? Medial rotation. Got it? Okay. Now, let's do the same thing. You know the answers now, and you're starting to see the pattern, which is exactly what we want, right? The latissimus dorsi. Latissimus dorsi, okay, back here. You guys have met it, right? It goes from here up onto the humerus. It's a weird-looking muscle, okay? It goes all the way from here up onto the humerus. It's kind of like wings. If you've ever seen a dude with like amazing V shape, that's the lats back there. So just take a picture next time you see it. Don't do that, it's super creepy. But okay, so latissimus dorsi, more likely, based on this location, to do abduction or adduction at the shoulder. Adduction, adduction, medial surface, right? More likely to do medial or lateral rotation. Lateral rotation, yes, pulling backwards. Do you see? Okay. You can even feel it happening back there. You can feel the muscles tensing when you do lateral rotation, right? You can use your body during a lab practical as much as you damn well please, as long as you keep your clothes on. Okay? Keep your clothes on. Just do it for the rest of us. Okay? Even if you got that, still keep your clothes on because that's distracting as hell during the lab practical. People can be like, I forgot all the names. But you can use your body, and it's actually really useful because you can feel when muscles are contracting with an action. You totally can feel it. Okay, you guys got it? And that answers your question, right? Which is what the hell is happening here. That's actually rotation, which is a different thing. Okay, so now we've got a couple more. These are kind of special movements. These are mostly the radius, rotating around the ulna. And these are supination and pronation. And supination and pronation are really, you name them for how you end up. If you supinate, you end up being able to drink some soup. If you pronate, you pull it out. Supinate, pronate. Now, I know that you know this, but I want it to make sense too. Instead of memorization, I'm going to ask you, first, what joint am I moving when I'm supinating and pronating? Yeah, it's the elbow. It looks like the wrist, right? But that's not it. It's the elbow joint that's moving, yeah? So the muscles that supinate and pronate have to cross the elbow joint. Yes, they have to. What I challenge you to do is to practice, figure out why the hell the supinator is where it is and the pronator is where it is. Look at their locations, figure out why they are located and where they are, okay? Does that make sense? So what I'm doing with these, by the way, is I'm starting with the radius and the ulna parallel to one another, and then when I pronate, I cross them, and when I supinate, I straighten them out again. Pronate. Now, why do they stay the same distance apart? Because remember, they have an interosseous membrane giving them that space between them. So that's supination and pronation. It's really neat here. Good? Okay. All right. So that's supination and pronation. Got it? Okay. All right. And then special movements at the ankle. So somebody didn't get the memo and they named two different opposite functions, both flexion, little bastards. They're like, I'm just starting to get this, and then they change it because that's what they always do. So dorsiflexion and plantarflexion, you ready? Dorsiflexion. You name for what you move toward with dorsiflexion and plantarflexion. So with dorsiflexion, you're bringing the top of the foot toward the dorsal surface, or the shin. That's dorsiflexion. Yes? With plantarflexion, you're bringing it toward the plantar surface. Right? Does that make sense? Okay. Now, let's test your mechanics and see if you can figure out where a muscle would be that's responsible for dorsiflexion. Where is it going to be? Anterior surface. Yes? It has to cross the ankle. Yes. Do you see? That now when you run into a muscle like the tibialis anterior, what is your immediate thought about its functionality? Dorsiflexion, right? And it's probably going to do that, and it does. Okay? Now, a muscle responsible for plantar flexion, which is that, right? So look at the mechanics. Where's that muscle going to be? Posterior surface, has to originate somewhere up here, somewhere proximal, right? And if you want it to have some range of motion, it better cross more than just right there. It actually crosses all the way down onto the calcaneus and pulls it up, right? So now the gastrocnemius muscle, which is back there, you don't have to memorize what it does now, do you? Because the gastrocnemius does which? Dorsiflexion or plantarflexion? Plantarflexion, right? Because that's how it makes sense. Good? Okay. And the other two actions at the ankle are pretty subtle, but they're really important for like stabilizing you on like rocky ground, uneven ground. They're eversion and inversion. So eversion is taking the sole of the foot and pointing it laterally. Woo! Laterally. Okay. And taking the sole of the foot and pointing it medially is inversion. Good? Now, test. Where is a muscle going to be that's responsible for eversion? Lateral surface crossing the ankle joint, yes? Where's a muscle going to be responsible for inversion? Medial surface crossing the ankle joint. Do you see? Okay. All right. So, and then the last ones, before we actually get to the muscle naming, is jaw movements. Some other joints can do these too. The scapula can do these too, but I'll show you at the jaw first because it's easier to see there. So, protraction and retraction. Okay. All of these four jaw movements are really important for chewing. Protraction is shoving the mandible forward. If you do it really dramatically, you end up with an underbite. Retraction, pulling the mandible back. If you do it really dramatically, you end up with an overbite. Or you have one already, like I do. Okay. And then elevation and depression. Okay. Protraction, retraction, elevation, depression. Those are all really important for chewing. But you don't just do them at the mandible. You also do each of those, and they're hard to see and understand, so I want you to practice with them for just a little bit. So let's practice with the scapula. It's hard to see on me, but if you do it, you can get it. Okay, so elevation of the scapula, this. Okay, where is a muscle going to be that's responsible for elevation of the scapula? It's going to be on the back side. Where is it with reference to the scapula? Top. There's a muscle called the levator scapulae. That's tricky. I wonder what that does. Levator scapulae, right? Depression of the scapula. Pull them down. Yes? Where's the muscle going to be that's responsible for depression of the scapula? Inferior to the scapula. Does that make sense? Got it? Okay. And so this one is what's kind of difficult for people. So when you get to scapula activities, this is a little hard for people. Abduct and adduct the scapula, that's kind of weird. So what is abduct the scapula? Pull it out. Pull it out a little bit. Adduct it, pull it back. Right? But you have to feel it on yourself to feel it. So abduct, pull it out. Adduct, adduct. That make sense? Okay. All right. So that's abduction and adduction. Yeah, so you can have a lot of those. So did you have a question? Go ahead.
What is this motion called?
Oh, that's lateral. I think it's lateral retraction. But they don't usually cover it in this. But it's responsible for chewing to do that as well. Okay? Everybody good with this? Okay. One last little movement is opposition. And opposition between hinged jaw and all of that movement, that allows us to eat anything of any size if we can catch it, right? Because you can like yank off parts of it, right? Add into that opposition, which is taking your thumb and making it make contact with each of your other fingers. Really, really evolutionarily significant. Why? Because we can manipulate anything when we do that, right? So if you have the combination of a hinged jaw, huge cerebral cortex compared to our body size, and opposition, right? We ended up being in charge of the whole damn planet, right? And we got some global warming. I think we ought to give the dolphins a try. Their brain to body ratio is just as good as ours. But they don't have opposable thumbs, otherwise they might be in charge. They would probably be benevolent leaders, I think. So that's opposition. Opposition is not unique to humans, but the combination of opposable thumbs and a huge cerebral cortex is really pretty unique to humans. Okay, so now what we are going to do is we are going to use all of that action that we just learned and then try to figure out why muscles are called what they're called and how the muscle name can tell you where it is and what it does quite often. Okay, so before we go into all of this, I want to give you guys an example of how freaking useful this can be. You ready? Joe uses the forearm formula, and I think that in lab, and I think that Jill does too. This is actually, I think, Jill's baby that she came up with. And teachers all steal from each other, so I'm stealing it from Jill. Thanks, Jill. Okay, so this is using a bunch of the stuff that we've already learned, and we're going to see examples of it as we go through. But the forearms, to me, are the most difficult part. They're so freaking hard, and Joe says they're easy, and Chrissy says they're easy, and I think the entire nervous system anatomy is easy, and they both think it's hard, so we know that I'm right and they're wrong. So the forearm formula, if you want to understand how forearms names are related to their locations and their functionality, we can use a really good example. Let's see, which one do I want to use? Okay. So forearms won't always have all four of these, but let's use an example that does. Let's use the extensor, carpi, radialis, brevis. Okay, so they don't all have four names, but when you use this, you can see the pattern of how the naming works. So let's practice this, and then we'll go back and look at examples of all different kinds of things. When a forearm is named, the first word is going to have to do with the action. The second place is going to be the joint at which the action occurs. Yes? The third is going to tell you something about the location. And the fourth is going to distinguish it from a similar muscle, if there is a fourth name. Ready? So let's practice this one. So looking at the name of the extensor carpi radialis brevis, you can know a hell of a lot about where this muscle is and what it does. Yes? It's an extensor. Where should I look for it? Posterior surface. It's an extensor carpi. Posterior surface crossing the carpal bones. It's called radialis. Which side of the joint do I look for it? Lateral side, yes? Okay, and it's a brevis. The brevis versus longus or long versus short head has to do with the comparative lengths of tendons, not of muscles. The muscles are sometimes longer. So the brevis means that there are two of them, and this has the shorter tendon of the two of them. So do you see that by finding that, you can probably narrow it down to two muscles pretty easily. It's the extensor carpi radialis brevis. The extensor digitorum. What is that doing? Extensor digitorum. It's an extensor, so it's on the back side, yes? And it goes all the way to the digits because it does digit extension. Show me digit extension. All right? Okay. Flexor digitorum superficialis. Find it for me. Flexor, yes? Going all the way to the digits. And it's superficial. Yes? It does this, and it's the superficial of two, and one of them is deeper, profundus. Does that make sense? Do you see? Okay, so let's practice some of the muscle naming to see what you guys can glean from the name of the muscle. Okay, so there is no one convention for how muscles are named. There's a bunch of different ways that they're named. One of the ways that they're named is by their action. So I want you guys to think to your lab list. You don't have to write these down right now because you can write them down later. But name me a muscle that has the word flexor in it or the word extensor in it. A flexor. Flexor carpi ulnaris, right? Flexor carpi ulnaris. An extensor. Extensor carpi ulnaris. Good. Right? that make sense? And you know where to look for them, right? Because of their names. Tell me a muscle that has the name adductor in it. Adductor magnus, adductor longus, adductor brevis, and then there's an adductor pollicis, right? But there's also an abductor pollicis. Do you understand that if I have 3 muscles in the pollicis, I can now tell the order of them? So if I have an extensor pollicis, it's back here. A flexor pollicis, it's here. An abductor pollicis, it's here. And where the hell is the adductor? All the way on the medial surface, right? Got it? Okay. Levator. We met one of those. Levator scapulae. Do you know a depressor? I'll teach you a depressor today if you don't know one. You don't have to learn it for lab, but it's just one that the name makes sense, so I'll reinforce it with you. Do you know one? I don't think you guys learn one in lab. I'll show you one just to make sure that you understand what the difference is between a levator and a depressor. Okay, pronator and a supinator. You should know. Pronator teres, and then the supinator blank. Supinator. Okay, and then sometimes you have muscles that are called rotators. The rotator cuff muscles are actually involved in rotating here. There's 4 of them. They don't have rotator in the name, but collectively they're called the rotator cuff muscles. And then the pyloric sphincter. Sphincters close tubes. You obviously don't see them a lot when you're looking at skeletal muscles on the outside, but you do have sphincters a whole bunch of different places. And then you do have one tensor muscle. What's the tensor muscle that you have? The TFL, tensor fascial locking, over here. Good? Okay, so now the other way that sometimes muscles are named is by their orientation of fibers. So when you look at the fibers in a muscle, actually you can't see the fibers, FYI, but you can see bundles of fibers. So an individual muscle fiber is microscopic and you can't see it, but they're bundled into bundles that are visible with the naked eye called fascicles, and you can see the fascicles, okay? So a muscle that is called a rectus muscle has fibers or fascicles that are straight up and down parallel to the long axis of the body, and you've got 2 rectus muscles that you're learning. Rectus abdominis and rectus femoris, yeah. And you can find them because their fibers are straight up and down. Good? Okay. There are also transverse or transversus muscles. A transverse or transversus muscles has fibers that run perpendicular to the long axis. And you only have one muscle that's called a transversus muscle, and that's what? Transversus abdominis, yeah? Okay. You will, however, have transverse fibers for things, like for instance, the trapezius has transverse fibers right here that abduct the scapula. Okay. And then you also have some oblique muscles. Oblique means it doesn't go parallel or perpendicular at some other angle. You have 2 muscles that are called oblique. What are those? External abdominal obliques, internal abdominal obliques. So let's learn those, okay? The external abdominal obliques are external in 2 ways. They're both the most lateral and the most superficial. So they're out here. And their fibers go this direction, X to the 6. Go straight for your junk, okay? And then the internal abdominal obliques are internal in 2 ways. They are both deeper and more medial. Good? So into the chin, internal obliques. So external obliques out here, internal obliques in here. Good? And if you know that, I can do the intercostals with you because the intercostals have the same pattern. Even though they're not called oblique, they do have oblique fibers, yeah? Okay, the intercostals have the same pattern as the obliques, and that is external intercostals, right, are external in 2 ways, lateral and superficial, X to the 6, external intercostals. Internal obliques, or internal intercostals, are medial, or are internal in 2 ways. They're both more medial and deeper into the chin. And that's how their fibers run. Does that make sense? Okay. So once you have the oblique pattern down, you can use the same pattern for the intercostals. Works the same way. Good? Okay. And then part of the reason I made you learn all of this terminology at the beginning of the semester is that sometimes muscles are named for their specific body locations or their relative locations to one another. So because you are brilliant, you will not go looking for the brachialis muscle in the leg, will you? No. You will know exactly where to look for the rectus femoris. Yeah, because it's over the femur. The intercostals are no mystery because their name says where they are. Yes, between the ribs. The temporalis muscle, no mystery. Now, what about the vastus muscles? Vastus means big. But you also know what lateral, medial, and intermediate mean, right? So you know where the vastus lateralis, medialis, and intermedius are. Where are those muscles, by the way? They're in the anterior thigh. They're part of the quadriceps group. Yes? And you know them in order. There are 3 big muscles, lateral, intermediate, medial. There are 3 of the 4 quadriceps muscles. What's the 4th one? Rectus femoris, exactly. Good? Okay. Now, superficial versus profound or superficial versus deep is also something we learned, right? Flexor digitorum, superficialis, and profundus is deeper than that. Does that make sense? The profundus, by the way, interestingly, is also profound in another way. The digitorum superficialis moves this joint, but the profundus, I always remember because it goes more profoundly to the bottom because it can do this too, right? It's deeper and it goes all the way to the end. Does that make sense? Okay. Supraspinatus versus infraspinatus. Where do I look for those? Above and below some kind of spine. What spine is relevant here? Scapula. And then if you knew that one was above and one was below, then you could more easily figure out their functionality relative to one another, right? Does that make sense? Okay. All right. So muscles are also named for their shape or structure. This requires you to remember a little bit of geometry, but not too much. The deltoid is called a deltoid because it's what shape? Triangle. Who remembers what a trapezoid is shaped like? It's kind of like a diamond. It's a quadrilateral, but it doesn't have necessarily even sides. And I don't know why for years and years I couldn't remember which one was the trapezius and which one was the latissimus dorsi. Sounds stupid now, but I couldn't until I was like, oh, this one's a trapezoid. So this one goes, your head is up here, right? Your booty is down here. Yeah, this is trapezius. That's what it's called. It's called a booty in anatomy. Okay. Quadratus lumborum. Now, tell me what that name is telling you. Quadratus. 4 sides. And it's in the what region? Lumbar region. It's a little bitty rectangular muscle right here in the lumbar region on both sides. Quadratus lumborum. Serratus anterior. Serratus. It's serrated, yeah, it's got fingers right here, and it's on the anterior side right here. Serratus anterior, if you've ever seen anybody who's in amazing shape, sometimes you can see all of those jags right there. So that's the serratus anterior. Platysma, do you know what plat means? Like the duck-billed platypus, yes? Flat, okay? The platysma is this big flat muscle right here that does this. Pretty, all right? You're gonna feel it. Act like you're terrified and disgusted. That's platysma, right? It's flat. She's like, ew, you're unattractive. It's fine as long as she makes an A. Okay, so muscles are also, muscles, this is how I wish all muscles were named. They didn't let me decide. Because if muscles are named for the muscle attachments, then you know where it is. And if they do what they do, which is name them with origins first and then insertions, then you also know what it does, right? Like the brachioradialis. If brachio starts it and radialis ends it, then you know it has elbow activity, yes? Okay. Sternocleidomastoid. Cleido means clavicle. So it goes, the 2 origins are listed first and then the mastoid process of the what bone? Temporal bone, okay? Notice that if you have sternocleidomastoid, now you can know what it does because if you contract both of them at the same time, you can do flexion, right? But I want you to feel this. This is weird. People have trouble understanding this. I want you to feel your one side as you move your head toward the other side. Can you feel that this is the muscle that is actually responsible for doing that? So this right anterior portion, the sternal end of the sternocleidomastoid, is responsible for, when it contracts by itself, turning your head to the left side. Can you feel it? Okay. Can't you feel it? You can even see it on me, right? That seems counterintuitive, right? What if I contract both of these at the same time? Yeah? Then I can move it over here, right? So what you want to do is you want to mess with your own body enough so that you can figure out how the mechanics of the muscles actually work. And remember that you can wiggle as much as you want during your lab practical. So that's the sternocleidomastoid. And you didn't learn this one, but the sternohyoid goes to the hyoid bone, and it's under here. Just pull down the hyoid bone when you need to pull it down, because it's sternum to hyoid bone. Does that make sense? Okay, this is how they should all be named. Okay, last but not least, muscles are named for their number of origins. Muscles can either be different heads of the same muscle or part of the same group. So a biceps muscle has two different origins sharing a common insertion. That's what biceps means. Okay, that means that they are probably going to move the same joint, but remember that if they don't have exactly the same origin, they might have another action for one of them. Does that make sense? Okay, so give me your two biceps. I know you know them. Biceps brachii and biceps femoris. Yeah, biceps femoris is back there. Three origins is triceps. And one example, of course you know it, triceps brachii. You have the long lateral and medial heads of the triceps. Please remember that the long refers to the length of the tendon, not to the length of the muscle, which can be confusing if you expect it to be the muscle that is longer. And then quadriceps. These actually used to be considered one muscle, so they called it the quadriceps muscle, but now there are four of them, and they have four different origins with the same common insertion, so they just call it the quadriceps group, quadriceps femoris group. Good? Okay, so I want to practice with you guys. And I know that some of this is easy for some of you guys, and some of you guys don't understand what the hell I'm talking about the whole damn time. So what I want to do is, when you see the name of a muscle, I want you to raise your hand if you're confident at telling me what this muscle's name is telling you about the location. And then I'll ask you something about the function. And I don't care if you get it wrong. We're in the learning process. It makes absolutely no difference. And I promise I'll be nice to you. Okay, so what can you determine about these muscles by their names? So raise your hand and tell me what you glean from the name tibialis anterior. Go ahead.
It's on the anterior side of the tibia.
Okay, good.
I think it's going to dorsiflex the ankle.
That's exactly what I was about to ask you. Is it going to dorsiflex or plantarflex the ankle? Okay, right? Ready for the next one? The temporalis muscle. It's pretty damn easy, but I'm going to ask you a follow-up question about it. Who can tell me, raise your hand if you are confident with temporalis. Go ahead. It is attached to the temporal bone. And being attached to the temporal bone, I'm going to give you two choices as to its functionality. Is the temporalis more likely to elevate or depress the mandible? Elevate. And why? Because it's above the mandible. Yes? Does that make sense? Okay. All right. Sternohyoid. What do you think it's going to do? First of all, raise your hand if you can tell me where it is. It's down here. What's it going to do to the hyoid bone? Any idea? If sterno is listed first, is it going to pull the hyoid bone up or down? Down. Yes, that's what it's going to do. Does that make sense? Okay. Supraspinatus. Somebody raise their hand and tell me what that tells you. Above the spine of the scapula. And go ahead. No, you go. Well, I want you to just tell me what you know, and then I'll ask. Yeah, what's that word? What's that term? Elevates scapula. Good. Okay, good. Erector spinae. There's a decent amount of information in that name. So somebody raise their hand and tell me what they glean from the name erector spinae. Erector spinae. Go ahead.
Well, it's down along the spine and back, and it makes it straight.
The fibers are straight. Yeah? Fibers are straight up and down. Now I'm going to give you two choices. You ready? The erector spinae could be responsible for flexion of the vertebral column or extension of the vertebral column. Which one? Extension, right? Because extension, it's going to be on the back side, so you're going to be doing extension, unless you're the knee, right? And you're not the knee there. Does that make sense to you guys? Okay. Number 6. Who is confident at like working me through flexor carpi radialis, location, function, all of that kind of stuff? I will help you, I promise. Raise your hand. Go ahead. Good. Okay. It flexes at your wrist joint, exactly. And it's on which side, lateral or medial? Lateral. Lateral, good. Does that make sense? Flexor carpi radialis? Okay. Right, who's confident with doing the, talking us through the extensor pollicis longus? Extensor pollicis longus. Go ahead.
So that's going to be like on the lateral side of the thumb.
Lateral, extensor. Let's work on that. Where should the extensor be? Thumb is right. Okay, well first just find extensors. Where would extensors be? Posterior, okay. Extensor, pollicis. And then what does the longest tell you? Yes, exactly. So the extensor pollicis, can you guys show me extension of the thumb? It's a little hard to do. So take the thumb and move it toward the back. That's extension of the thumb. That's flexion. Extension. Abduction. Adduction. Got it? Does that make sense? Okay. The thumb is the hardest to me because there's like 4 different muscles that just go to your thumb. And why is that? Because of opposition. Yes, exactly. Okay, you didn't learn this one, and you don't have to know this one. I'm just using this to test whether you understand the naming conventions. You ready? Okay, I want you to think about this, and then raise your hand if you think you can do it. The depressor anguli oris. Depressor anguli oris. Okay, good. She's working through it. Trying not to move my face while you guys figure it out. It's hard. Or doesn't do this. I'm just trying not to move my face. Depressor anguli oris. Any idea where it might be? And not the mandible, the mouth. Depressor anguli oris. Ooh, got it. Do that. Mm-hmm. This is your depressor anguli oris. So what happens when you have to study for anatomy. Mm-hmm. They should teach you this one, right? Because you use it a lot. So it goes from here to here, here to here. Depressor anguli oris, right? So it yanks your mouth down. It's part of one of your facial expression muscles. Good. Okay. So even though you didn't know that one, you can kind of figure out where it is based on the pattern that you learned. Okay. Vastus intermedius. Not where is the muscle based on memorization, but what is the name telling you? Big and in the middle of some other ones, yes? Okay, last one. Levator scapulae. Talk me through, not your memorization, but how you would tell someone who hadn't met the levator scapulae why you know where to look for it. Go ahead.
I think it is so that elements and scapula, so it's located on the posterior side, superior of the scapula joint.
Exactly, so that it can pull the scapula. Yeah? That makes sense? Got it? So, so before we move on, and we're going to move on in just a second, let me tell you how I am going to quiz you over this stuff on Monday. Because what I want to do is I'm going to do 2 different types of quizzes on muscles. The first one is not memorization. The first one is muscle logic and muscle mechanics. So how will I test you on this? What I will do is, and you've got some time for the memorization. What I'm going to do is I'm going to say a muscle is attached here and here, give you 2 locations, and ask you which of these actions is logical at that point, right? Okay, so if I told you there was a muscle that was running over the anterior surface of the hip, attached to the anterior superior iliac spine and somewhere on the femur, then I could give you flexion at the hip, extension at the hip, abduction at the hip, adduction at the hip, flexion at the knee. I'll always put the wrong damn joint in there, and half of you guys will choose it every damn time. You're like, it didn't even go past that joint. How the hell did it do that? Because it's magic. So I'm going to do it that way, right? Attach it, and then see if you can figure out how it would wiggle, and then I'm going to do it the other way, which is wiggle it and see if you can figure out which of the list was the origin and which was the insertion, right? And then I'm going to ask you based on names where you would find the muscle. So kind of like what we did today. The second quiz that you have over muscles, which will not be next Wednesday, it's going to give you guys some time to like absorb it, practice it in lab. The second quiz will be doing the same kind of thing, but with specific attachment points that you have to learn for lab, and using the specific muscles that you have to learn for lab. Instead of pointing to the sartorius, I will say, there is a muscle that attaches from the anterior superior iliac spine and goes here and does this, name the muscle. So in lab, they do it the opposite way, right? They tag the muscle and have you do the functionality. In lecture, I'm going to do the same muscles, but approach them from the other way. And if you put them both together, you will learn those damn muscles. You will. And every once in a while I'll ask you a picture too, but like, you know, if you can ask the vastus intermedius in lab, don't you see that it's kind of superior to ask it in lab than it is to asking it in a two-dimensional picture in lecture? In lecture, it's more important for you guys to understand functionality and logic and all that kind of stuff. Everybody good? Okay, do you guys have any questions over muscles? Do you hate them? No. Muscles are great. They just don't stick very quickly. You just like have to like get them in there. Okay. No, we're not leaving early. We're going to start the next thing. Here, well, I know you guys are like, I'm freaking worn out. You just let me out. I'm going to lock the doors and we're all going to stay in here together. No, I'm just kidding. I would never do that. Okay. So we're changing gears now, and we are going to do stuff that does not correlate to lab. You don't do this stuff in lab, but it is directly preparing you for the stuff that you need for phys. Okay, so this is totally changing gears. So what we are going to do with this part of the notes is to break muscle all the way down to the submicroscopic level so that I can teach you how it actually contracts. And you have to get all the way down to like talking about the ions that are released in the muscle that make the contractions and the proteins that are made. So this changes gears quite a bit, but this is really, really super important for phys. As a matter of fact, people have a very hard time in phys if they didn't understand this in anatomy, because I don't go back and teach the anatomy over again. I just start wiggling shit and people are like, whoa, whoa, whoa. They're like, you stop it. You tell me what a myofibril is again. And I'm like, hell no, I'm not gonna. Go back and look it up. Because I have to leave out a body system if I reteach the anatomy. Okay, so before we get into the nitty gritty of it, let's just talk about what's special about muscle tissue compared to other muscle tissue. And this stuff is really easy. May or may not have occurred to you before. Muscle is special because it can respond to an electrical stimulus, right? There are only a few electrical tissues in your body. All three types of muscles and nervous tissue are electrical, meaning that if you zapped them, they would respond. Or if you got electrocuted, you'd fry all of them, right? So what would happen to your heart? Skeletal muscle does this when you get electrocuted. Your brain does too. So it's an electrical system. It's got the characteristic of excitability. And then muscle, unlike any other tissue in the body, the three types of muscle respond in a specific way to an electrical stimulus. They have what's called contractility, and that means that when you stimulate them, they actually shorten. And they're the only tissue in your body that does that. That's called contractility. But they also have another functionality, and these two are related. They have extensibility. Extensibility means that you can actually stretch the muscle, the connective tissue in the muscle, and give it more range of motion. So if your hip flexors are really tight, most of ours are, right? Then what you can do is you can stretch your hip flexors, yes? Okay, but it wouldn't do you any good if you stretched them and then they became flaccid, because they also need to have elasticity. So you can give them more range of motion, but they're gonna snap back and retain their functionality. Does that make sense to you guys? Okay, so that's important for muscle. And then let me show you that you are also going to be responsible again for the table that you had that was kind of like this, that was in your histology notes. So again, you are going to be responsible for reviewing which type of muscle is striated versus not striated, which one is uninucleated, which one's voluntary. All of that is back in your histology notes. You're still going to be responsible for that. Good? Okay. All right, so let's talk a little bit about muscle functionality. Of course, everybody knows that muscle makes you wiggle, but it's not all that it does. Muscle does make you wiggle. If it's attached to your bones, it can move your skeleton around. If it's attached to your skin, it can move your skin around, right? Your facial muscles, for instance, are not actually attached to your bones. They're just attached to little different points in your skin. That's why they're moving your face around. So motion, they can also move things around inside you, like the heart is moving blood through, and smooth muscle in the walls of tubes is moving things around. But your muscle is also responsible for holding you still. So postural stability, so me holding myself still or you holding your neck up right now, you can only do that because you are having muscle contraction. If that doesn't make sense, think about whether I could stand in front of you if I were quadriplegic. I couldn't, right? So even holding myself still, I have to have ab and back contraction, glute contraction, thigh, right? And I have to have muscular contraction to hold my neck up, right? So postural stability is muscular contraction. In addition, sometimes muscles, just spanning a joint helps to stabilize the joint. So if you have a nice strong muscle around a joint, then the joint is less likely to be damaged. Think about that with like having a bad back. Damn near all of us are going to have bad back at some point. Way more likely if you're tall. Do you tall people know that you get worse backs than the rest of the people? You do. Yes. It hasn't happened yet. Enjoy right now. My husband is 6'6", and he spent most of his life like picking up stuff like this. And now, like, it's all jacked up back there. But luckily, he's like, no, I can't help you move. I can't help you move. I know I'm 6'6", but I can't help you move. And no, you can't borrow my truck either. So if you have a bad back, what does your PT or your physician tell you? Never use it again? No, you need to strengthen the muscles in your back and also the antagonists on the other side to help stabilize the joint. So postural stability, heat production probably doesn't seem particularly relevant, but it's pretty important in physiology. Muscle contraction is actually converting ATP chemical energy into mechanical energy. And do you guys remember enough of whatever science class you learned this in to know that energy conversions tend to be really inefficient? Do you remember that? You tend to lose about 40% of any energy conversion as what? Heat, exactly. So muscular contraction is a really, really good way to heat up the body, which is why when you get cold, you contract and relax your muscles really quickly to generate that 40% byproduct of heat. Then, in some places, muscles are just about keeping stuff where it goes. So the muscles in your abdominal muscles are about moving, but they're also about keeping your organs squished against the back body wall. If you really damage them with like a surgery, like if you have an emergency abdominal surgery, they'll slice right through them, and then you will have a pooch even if you don't have any subcutaneous fat. Also, these muscles down here, called the pubococcygeal muscles, right? Those muscles right there in the pelvic floor. Those are keeping your junk up in there. And lots of women damage the hell out of those muscles during childbirth, have a whole bunch of big-headed babies over and over again. You can completely trash the pelvic floor muscles or the pubococcygeal muscles, and then you can have your uterus flop out and your urinary bladder. I don't know why they don't teach teenagers that if they don't want them to have sex. All you have to do is tell these girls, nice girls right here, do you want your uterus to fall out? And she's like, I literally do not. I mean, he's hot, but no, I'd rather keep it up there. So don't think I haven't told my son that, right? You're gonna make somebody's uterus fall out, dude. He's like, man, mom, stop it. So it's called uterine prolapse, and it doesn't like hang out of the hole, it hangs out in the skin, so it's just like flopping around down there. Woo! So support. So keep that stuff intact if you can. Do some Kegels. Nobody can tell when you do them. If you do 10,000, you might even burn a calorie. Guarding openings. Your sphincters guard openings too. They're keeping stuff moving through tubes when you want it to and not when you don't want it to. But you only have 2 skeletal muscle sphincters that you're under voluntary control of. The one at the end of your digestive tract and the one at the end of your urinary tract. All the rest are smooth muscle sphincters, and they're involuntarily controlled. And then the last thing is that muscular contraction keeps fluids moving in ways that make sense to you, and then in one that you might not already know. Of course, the heart, right, is going to generate the pressure to keep blood moving, right? And then the smooth muscle in the walls of any tube will keep stuff moving through the tube. But did you know that it's also really important to have skeletal muscle contraction to keep fluids moving? Because, for instance, the blood that's coming through your veins back up to your heart, it's relatively low pressure and it's going against gravity. So how do you help it move? Well, yes, the smooth muscle in the walls of your veins will contract to help keep it moving. But again, also, when you contract the skeletal muscles around the veins, they squish on the veins, yeah, and move stuff back. It's called venous return. That means that you already knew that when you were more active, you have better blood flow, but you thought it was all because of what your heart was doing, right? But now I'm telling you that you also have better blood flow back because of what your skeletal muscles are doing. Does that make sense? So the more active you are, the better flow you have of fluids in your body. Is that good? Do you have a question?
Oh,
No?
sorry.
Okay. All right. So we're going to stop right there because this stuff is kind of hairy to get into, so we'll wait until Monday. Your test will be posted Monday morning at the latest, but probably Sunday night on Canvas. And in addition, there will also be a breakdown of how you got the points posted on melanieb.com, because Canvas only lets me post 1 grade, but you actually had multiple choice, short answer, and bonus. So the breakdown of how you got the points will be posted on melanieb.com, and then the actual grade will be posted on Canvas. Cool? Everybody good? Okay. Good luck in lab. Go have fun. Did it go away?